Dear friends, hypertension prevalence is increasing not only in the world but also in Southeast Asian countries and even our own country in India. The prevalence of diabetes is increasing. The most important part of increasing hypertension is not only it is increasing in urban areas but also in rural areas. Recently concluded ICMR INDIAB study as a part of investigator in this study in Rajasthan, what we found was that even hypertension and diabetes both are increasing even in rural areas to the tune of around 6 to 8%. That is very alarming for all of us. The factors may be different, and factors may be the stress, day-to-day life problems, and there are several out-of-the-box problems like stress of the noise, the family stress, and of course our sedentary habits. We are not doing enough physical activity, and that is one of the reasons for increasing hypertension in our society. Apart from that, it is the measurement of blood pressure, which we have learned very early during our medical days, but still what we found that measuring blood pressure is not very correct. Now, for example, the ideal situation where the blood pressure should be monitored is that patient should be calm and quiet. He should not be talking while we are taking blood pressure. Another thing, he should not have taken any tea or coffee or any caffeine sort of beverages just before measuring your blood pressure. Similarly, he should not having any anxiety before measuring the blood pressure. Another thing about the measuring blood pressure is your posture. Your back should not be bending forward when you are measuring blood pressure. Your arm should not be tossed when you are measuring blood pressure. Hence, there are several conditions whereby just having a postural difference, just having anxiety or beverages or everything, the patient's blood pressure always on a different, it may be very, increased to the tune of having hypertension. Whether the patient was a normotensive, but because of these unavoidable circumstances and situations, the blood pressure is rising. Hence, dear friends, these days we should have not only the office blood pressure measurement, we should encourage our patients to have the ambulatory blood pressure measurement, or the patient should monitor their blood pressure at their home. If they are measuring their blood pressure at the home with the correct blood pressure instrument, that is very important, the validated automated blood pressure instrument, or what is called a digital blood pressure instruments, these days they are validated, and if they are very well calibrated, the blood pressure is always accurate. So always take the blood pressure instrument which is validated as well as calibration. And not only this, if it is, it is a good practice if you can calibrate your blood pressure instrument at least 3 months or at least 6 months in a year. That will give the real idea about the right blood pressure measurement. So the measurement of blood pressure with the good automated blood pressure, whether you are doing any, these days we are not doing any mercury sphygmomanometer for the measurement. So it is the automated digital blood pressure instrument is the best thing. Of course, there are several other instruments which are there, but I think the validation and calibration of blood pressure instrument is very much important. So dear friends, while measuring your blood pressure, you should have an ideal situation. The patient should sit at least 5 minutes calm and quiet in a calm and quiet place before measuring the blood pressure. And what I have told just now, the different situations, your posture is important. Patient should not talk while taking the blood pressure. These small things, if we take in account, then the blood pressure measurement will be an accurate one, and this will impact your clinical judgment. This will impact your the management of blood pressure. So thank you very much for the patience listening.
Thank you very much.
So I
Introduction after introduction.
okay.
Continue.
I am Dr. Arvind Gupta. I am the Senior Consultant Physician and Head Department of Diabetes, Obesity and Metabolic Disorders at Maheshwari, Jaipuria, Rajasthan Hospital, Jaipur.